Hi, this is Brian from Celebrity Dental Laboratory. I just wanted to make you this quick video. Okay, so there's three things that we can do to really make a stronger emax crown. These three things really can be applied to any restoration, whether it's emax, empress, zirconia, or even PFM, porcelain. It's all a glass and it kind of reacts the same way as glass. The first one is sharp occlusal ridges. Anywhere on the prep surface that has a sharp point to it can really cause problems. The second one is the evenness of the thickness of reduction. The amount really should be even all the way around the surface. The third one is the minimum requirements for reduction, how thin we can go without having serious problems. Okay, so here you can see I'm just kind of outlining the sharp area of this ridge. As you can see here, it's very sharp. In this situation, what you want to do is just take a burr and round these sharp edges off. The inside of the restoration is basically an exact duplicate of what this prep is going to be. So that sharp area in the glass is going to look like a score mark, and it's going to become a weak part where it could easily fracture. If it fractures, that's where it's going to fracture. Okay, so this is the second point, and that is the amount of reduction. You really want it to be uniform. You want it to be the same thickness of reduction throughout the whole prep, which can be really difficult, but what you really want to watch out for is any areas where it can be extremely thick or extremely thin. When these crowns fire in the oven, they go through thermal expansion and they expand and they contract, and the amount that they expand and contract depends on the thickness of the material. The problem is when you have a really thick area next to a really thin area, as this expands and contracts, it can create thermal tension on the crown as it bakes, and even if it hasn't fractured, it can create this tension that is basically pulling within the glass that wants to fracture, it wants to pop, and it wants to snap because these thicknesses are uneven, and it's creating this force from the thermal contraction. The third point I wanted to make was the minimal thickness. In the occlusal areas especially, really the minimum thickness of any product really should be minimum of 2 millimeters. Emax, you might be able to go a little bit thinner than that, but in this particular case we're looking at about 3/10 of a millimeter before the opposing is touching here, so we're really tight. We're really close here, and that's why we like to provide those occlusal guides. They're 2 millimeters thick. The patient can put those in their mouth, they can bite down on it, and if you can't pull that out without resistance, then that means you're going to need to reduce that area a little bit more. Again, the other thing that you can do is just a final quality control check before any impression leaves the office. Just hold it up to the light. Any fluorescent light or light you have, you just hold the impression up to it and look at the prepped area. If you can see light coming through the prep area in the impression, that means it's too thin. Just reducing this distal cusp of the opposing tooth here, probably about 5/10 to a millimeter, is going to help us get the clearance we need here, and I think the new crown's going to fit fine for you, and we should be in the clear. I hope you like this video, and thanks for taking the time to watch it.